Health insurance companies estimate premiums for Florida customers could increase by as much as 40% starting in January. Here to help break down why is Scott Darius, Executive Director of Florida Voices for Health. Welcome back, Scott.
Thank you so much for having me.
So, Scott, we hear a lot about property insurance rates and the possibility that they might increase. Health insurance is really the growing concern here, though. I mean, we hear about property insurance, but we're going to start hearing a lot about health insurance.
Yeah, I think especially as open enrollment starts here in November, the November 1st. I think part of what we're trying to do in having these conversations is making people aware that when they show up to sign up for their plans, when they try to renew come November 1st in this next open enrollment period, that they should expect to find that their costs have gone up significantly.
Yeah, well, what we're seeing is some reporting both by the nonprofit newsroom, The Phoenix, and by the Kaiser Family Foundation, which is an independent nonprofit that focuses on health policy research. 14 insurers in particular proposing double-digit increases for Affordable Care Act plans. This is according to a review of federal data. Now, these figures aren't quite official. Explain to us what happens. Typically, insurers are required to kind of publish their prospective rate increases, and we haven't really gotten the final numbers yet.
Yeah, so every year, kind of near the beginning of the year and around the summer, you have insurers who kind of evaluate the landscape and they set their prices for the next year. But before those prices become locked in, they have to submit them to, regulators. So we have the Florida Office of Insurance Regulation, and they review those rates. And typically, right, I don't want to say it's a rubber stamp. Typically, they'll move forward with it, whatever the insurers propose. But the insurers also have to include a justification for whatever they're charging. And so we all know premiums have gone up steadily over the years. Some years it's, I think there's always an increase, and some years it's smaller. I think what we're seeing this year already is a huge single year jump, right? That's what we haven't seen in at least 5 or 6 years, is this huge one-time jump in the numbers. But insurers always have to include a justification. And what we're seeing this time around is that they're specifically pointing to some of the changes in HR 1, the One Big Beautiful Bill, but also just some of the other things that are happening in the landscape, including the non-extension of the enhanced premium tax credits.
So explain to us what the premium tax credits are. There were some tax credits that initially helped subsidize people who wanted to go to the health gov. What is it?
Healthcare.gov.
Healthcare.gov site. That's the ACA, basically Obamacare. There were some incentives to help people enroll, and those were expanded somewhat during COVID. Can you explain what those, how those help people with premiums?
Yeah. So it's helpful to think of the ACA as a three-legged stool, right? They looked at the world, the U.S., and everyone above 400% of the poverty level, the federal poverty level. The thought was, hey, these folks make enough to qualify for health insurance and probably don't need any financial support. For folks making below 100% of the poverty level, the thought was, hey, we'll expand Medicaid and you'll have all these folks covered. But for people making between 100 and 400% of the poverty level, so people who we'd consider middle class or lower middle class, whatever it is, would probably need some assistance to keep up with the cost of monthly premiums and other out-of-pocket costs. So when the ACA in its original design included these tax credits for folks in the middle in particular, what we saw post-COVID, right, we all remember the world the way it was and the support that people really needed to afford things, especially as the cost of everything else seemed to skyrocket at the exact same time. And so in 2021, you had the American Rescue Plan that passed these enhanced tax credits. So on top of what folks were already receiving, we all received a little bit more support for monthly premiums and other out-of-pocket costs. And yeah, I think the impact from that it's in the numbers, right? Just the sheer amount of people we saw enroll in the marketplace since then.
I think we have Dr. Alonso with us. Good morning, Dr. Alonso. Can you hear us?
Yes, I can. Good morning.
All right. Good morning. Thanks for having us. Thanks for joining us here this morning. So we're talking about the possibility that we're going to see some significant increases in health insurance premiums. I mean, just based on the work that you've done here in Jacksonville over the decades, how is that going to impact your patients?
Well, impact them in a very negative way. I'm an emergency medicine physician, and I practiced in Jacksonville and Clay County, Duval, for over 30 years. And a significant portion of the population who's uninsured uses the emergency department for their only access to care, which we all know is very inefficient in terms of expenses. And Medicaid is, I would say, depending on what hospital you look at in the community, but usually around 30% higher in the pediatric population. So you are cutting out a huge number of patients that would not have access without Medicaid to primary care, so they would go to the emergency department for emergency care, which is, like I said, much more expensive.
And so when they're seeking emergency care, practically speaking, how does that impair the work that you're trying to do with a patient? How does it impact the care that you're able to give them?
Yeah, that's an excellent question. Well, people complain often that the wait times in the emergency room are very elevated. And part of the reason is we use a triage system, so the sickest come first. It's not if you got there first, but if a lot of people are coming in with sore throats, cough, and upper respiratory tract infections, things that do need some attention, but not an emergency room where they could see, if they had insurance, the private doctor, now spills into the emergency department world, and this causes a huge overflow, backup, and it impacts everybody. People who do have insurance will then also have to wait longer often, and the whole system is overburdened. So, primary care is essential, and to have good primary care, people need insurance to pay for it because it's so expensive in this country. So, yeah, it all ties in.
How does it impact the work that you yourself do or your colleagues when you're overburdened like that?
Well, it's very frustrating because, as you recall, when COVID hit, they were telling people not to use the emergency department to allow us to see the sickest of the sick, and people really listened to that, and I applaud the public on that. But now, when we're sort of back to normal, and as more, Florida is only one of 10 states that did not expand the Medicaid to fall under the ACA and capture. The estimates are 800 to 900,000 Floridians would be insured and now aren't because the legislature and the governor decided not to expand that. So that impacts me personally in that I'm seeing more people that do not need to be in the emergency room, but yet I have to see them. I can never deny them care. So it just overwhelms everybody. It causes burnout in nursing, frustration among doctors, overutilization of services.
Yeah. If you're just joining us, we are talking about what are predicted to be double-digit increases in health insurance premiums next year, unless Congress intervenes. If you have questions or comments, you can join the conversation by calling 904-549-2937. You can also email questions or comments to firstcoastconnect@wjct.org, or you can reach out on Facebook, Instagram, or Twitter at FCC On Air. So, Scott, in terms of, this spike, I mean, Florida is not alone. It is in good company. And in fact, just recently, NPR was reporting, an average spike of 75%. And they, talked to a patient that was going to see, basically a quadrupling of her own rates monthly. But Florida is uniquely vulnerable. And Dr. Alonso kind of alluded to why. But can you explain why Florida has a particular vulnerability when it comes to the changes that are coming down the pike?
Absolutely. I'll say there are two things happening at once, right? That maybe is worth spelling out. First, you have these increases in the base rate of what insurance is costing. You have these insurers who now are looking for between 20 and 40% increases in just what they charge normally. That's happening at the exact same time that people are losing these enhanced tax credits. So that's where that kind of double whammy hits, and people will get that sticker shock, I think, when they go to sign up for their plans. Now, Florida in particular, right? We have 4.7 million people currently enrolled in the marketplace. That leads the nation, and frankly, we've always led the nation when it comes to enrollment in the ACA plans. Just speaks to the level of need that exists here. But of that 4.7 million, you have 2.4 million of them who earn below 138% of the poverty level. So you have folks who, are very much at the lower end of the socioeconomic scale. What's happening, though, is I think Kaiser Family Foundation estimates that 2.2 million of that 2.4 will just be priced out of coverage. Will just, have no choice but to not get covered. But you suddenly have a doubling of our uninsured rate here in this state. Currently, in the last decade, we've done such a good job of reducing our uninsured rate down to 1 in 5 Floridians. If this hits, if 2.2 million people are priced out of coverage, suddenly our uninsured rate doubles. We go from 1 in 10 uninsured, to 1 in 5 uninsured. And so a huge vulnerability there. But we've also not expanded Medicaid, which would have covered folks up to 138% of the poverty level. So as these folks find themselves priced out of the private market, there's also no safety net here in our state to help them.
And so that was a decision that was made by our then governor,
Rick
Rick
Scott
Scott.
back in the day.
Right. But has been a policy that's been continued since then. And Florida wasn't the only state that refused to expand Medicaid, but other states that did have come back with citizen initiatives that have essentially reversed their governor's refusal and said, we want to expand Medicaid. Where does Florida stand in terms of trying to get that policy changed?
So I'll say the ballot initiative we've seen mostly in red states, in like conservative states where the people themselves are calling for it, right? And so Florida currently has a campaign, Florida Decides Healthcare, that's to put Medicaid expansion on the 2026 ballot. What encourages me in that work, right? It's still a tough climate to work in, but our most recent polling, we've seen close to 70% support for Medicaid expansion, and that's across party lines. In one of the polls we did, we actually, adjusted for the turnout. So we did a plus 13R, heavily conservative turnout, and still finished with 68% support for Medicaid expansion. And again, across party lines. And so it's a thing that people feel intimately, a need that people have, access to healthcare. And yeah, we'll just see how this, unfortunately, it feels like we're going to have to see this thing play out in the next couple of months before people respond and try to do something about it.
In terms of the widespread bipartisan support, I mean, it's been interesting to see a very conservative coalition here in Florida coming together to protest these insurance rate premiums, the ACA premiums doubling. And that includes Associated Industries of Florida, the Florida Hispanic Chamber of Commerce, and the Florida Hospital Association. So there is actually a group called Florida Conservatives for Affordable Healthcare that has been at the forefront. They've been having press conferences, they've been having, meetings to discuss this and to urge both, more people being allowed coverage and also preventing this premium increase. I mean, what can Congress do, for instance, at this point?
So Congress definitely still has this option, right? Still has this ability to not expand, but to extend the tax credits, the enhanced tax credits. They technically expire at the end of the year. And yeah, they have the option of passing legislation either through one of the budget vehicles or just passing a bill that says we extend these. And so we're still calling on our members of Congress to act because it's not too late. It might change the timing of things, considering that open enrollment starts November, and these insurers have factored in the fact that they're not expecting the enhanced tax credits to come back, so there might still be some wrangling that needs to happen. But fundamentally, there's still a chance to help people get the things that they need. The interesting point you make about this conservative coalition that's come together, just in conversations we've had with a couple of them, right? The Hispanic Chamber in particular, they talk a lot about the reason that they're out in front on this is because of the impact that they see on small businesses. In Florida, without Medicaid expansion, and I think that's been the benefit for other states, where you have small businesses that are unable to provide group coverage to their couple of employees, they have been able to move people to the marketplace and either give them some sort of subsidy or some sort of stipend to help cover that, or they just have folks who are able to afford coverage in the marketplace. You have, in the technical definition of small business, there are people who are self-employed, right? Just folks who are working for themselves. And so the marketplace has been really helpful in encouraging that kind of economic involvement, or that, people can get out in the workforce and do what they need to because they also have the security of coverage. And I think that's what scares folks like the chambers the most.
And aside from people under the ACA, we're talking about just small businesses with fewer than 50 employees that are also going to be seeing pretty significant rate hikes. Is that right?
Absolutely. Everyone's going to feel this in one way or another. And then just to make the other quick plug for Medicaid expansion is that in every state that has expanded, you've seen on average, a 7% decrease in the cost of premiums for people in the private market, right? It just changes the way the risk pools are set up, the thought that hey, we have more unhealthy folks or whatever it is in these covered by Medicaid and all the other things. And so the private market, we can price a little bit differently. So this idea that, if you're not personally impacted by the prospects of Medicaid expansion, you're kidding yourself. I think we're all kind of like tied together in these things.
Yeah. Dr. Alonso, I wonder if you can talk about that a little bit in terms of how just an overall healthier population can impact, premiums or outcomes even when you're talking about, the entirety of the population and not just people who might be on the government ACA plan.
Sure. I want to tie into something that Darius just said is that right now health insurance is dominated by the seven big insurance companies, Humana, Aetna, United Healthcare. Most of these know what these are. And the smaller local or statewide insurance companies depended on the marketplace. And if we eliminate the marketplace, these options, like you said, for gig workers and a lot of, people that are like Uber drivers or just small businesses dependent on these because the rates of these other ones are so much higher. But answering your question is, it's just that peace of mind that if you have insurance and we all know a family member suddenly getting ill or women suddenly being diagnosed with breast cancer and mammograms and the ultrasounds and all the testing, all this is very expensive out of pocket. And even with insurance, there's co-pays and deductibles. So insurance is not a guarantee, but at least it's sort of a buffer so that it doesn't throw a lot of people into bankruptcy. And I want to remind the audience, the number one reason that Americans go into financial debt and bankruptcy is medical costs. So insurance helps buffer that, and that's key.
I want to ask you because we got a question from Ed on Facebook, Dr. Alonso. He's saying at the beginning of the ACA, CEO of Mayo said everyone wants universal health care, low cost, and top high quality health care. The reality is that you can only have two of the three at the same time. If you have universal coverage and low cost, you can't have top quality health care. If you want top quality health care and low cost, you can't have universal coverage. Can you comment on that? Do you believe that analysis still holds true?
Well, healthcare is a very complicated subject, and we could spend hours talking about it. But I'm a big fan of universal healthcare. The question is, people in America think we have the best healthcare in the world, and the answer in a way is yes, if you have a lot of money. If you're very well off and you can pay all the co-pays and deductibles and get the top gold plan insurance, sure, this is an excellent system. But for the average American, this system is totally out of control and inefficient. So we are the only developed nation in the world that does not guarantee health care for everybody. So if you look at health outcomes in terms of infant mortality, longevity, multiple factors, access to health care, we rank around the bottom. And crucially, we spend the most. So you got to ask yourself, if we're spending more per person, per capita, it's about 18% of GDP. Most other developed nations are around half of that. And yet they cover everybody. Who is making the money? That's the question. So I think the key is not having the fanciest gizmo and laser and cyber knife, and you'll hear about all this robotics. But if people can't even get care for the two biggest conditions in America, which are hypertension and diabetes, if they can't get their pills, their insulin shots, the basic stuff, none of this glamorous baboon heart transplant and stuff that you hear in the news, it's amazing. Well, if most Americans can't get the basic stuff, I argue, well, what's the point of all this fancy stuff if that's just a small slice of the big pie? We should try to benefit the most people.
Scott, Darius, in terms of what people can do at this point, first of all, I'm just curious if you think that the state has done an adequate job of letting people know that this is coming, whether people can do anything to weigh in on it before it happens if they are concerned about these soaring healthcare costs.
Yeah, sometimes it feels like such a technical issue, right? To explain to people, hey, it's your tax credits that are going away. Yeah, it doesn't land, or we haven't been doing the work of like getting that in front of people. My big concern is that people won't see it or feel it until they sit down to review their plans for next year and they realize, oh wait, I've been getting tax credits that have made this plan like so affordable. So that's what we're doing now is first just trying to get this information in front of folks.
Do you think most people know that they're getting tax credits?
I'd like to think that they at some point knew, right? Like while they sat down, hopefully with a navigator or whoever they worked with to sign up, at some point realized, hey, I'm getting a little extra credit. And that's why this thing it's been so affordable for me this year. But it's an easy thing to forget. I'll say that. You just kind of get into the rhythm of paying your bill, you feel good about it, and you walk away from it. It's when you sit down again and you realize, oh, maybe things have changed for me, right? Like maybe your work has changed or other like life circumstances that were going to impact how much you pay anyway. But then you realize that there's no additional help regardless of what's happened to you. So yeah, it's just it's that really tough moment that we're trying to put in front of people before we get to that point. And mostly because there's something they can do about it right now. Folks can contact their Congress people, both your House of Representatives and senators, and encourage them to do something about this in the coming months, especially as folks return back to D.C., I think this week or next week. So, yeah, there's an opportunity and a moment for it. But while we're not, I don't want to encourage people to just do that. There's this Medicaid expansion ballot initiative. That's a very concrete way for us to get involved and help provide care to what we're now estimating to be over 3 million Floridians who would need the access to care if we lose the aid tax credit. So, just encourage people to check out FloridaDecidesHealthcare.com.
We've got a call from Daryl in St. Augustine. Good morning, Daryl. Go ahead.
Yeah, good morning. Just like the physician just said there, universal health care is more efficient. It's better for the entire country. Profiting from the ill is not a business model. And that's what we're doing. We're trying to find ways to make money from sick people. Sick people don't pay taxes. So it's in our best interest to have universal health care so everybody gets up, goes to work, pays their taxes, and our economy is successful. This idea that you make money from sick people is a little absurd in any other country in the world.
Thanks, Daryl. Appreciate that. Just finally, in terms of the timeline, I mean, I mentioned, Scott, that these are not final yet. We're still sort of waiting on this insurance review and then those rates to be formalized. When do you expect that to happen?
October. Usually in the first couple of weeks of October, you'll get the specific plans for the specific prices for each specific plan that's in the marketplace. I think a lot of the plans themselves have changed. A lot of times, right, in the last few years, you've seen plans kind of carry over from year to year. You might get some slight changes, but generally the same plan has been available over time. I think that's shifting a lot just based on all the other things happening in the landscape. And so we'll see a final kind of look at it, I believe, in the first week or two of October.
Soon before open enrollment starts. Well, Scott Darius with Florida Voices for Health, Jacksonville Emergency Medicine Dr. Leonardo Alonso, thank you both so much for being here. Really appreciate it.
Thank you so much for having us.